My name is Amy Rhodes. I'm a 4-H educator with the University of Maryland Extension. Children are definitely a focus area in my professional work. I worry about them on a daily basis when it comes to their mental health, and especially after the year that we've had and the changes that we've had, some of those concerns may be showing up a little bit more in our children, and we need to really be aware of them. Every person actually experiences stress, and that includes our children. But I know as adults sometimes it's hard to think about them experiencing stress because we are kind of caught up in our own world of stress and worry, and we really need to think about ways that we can acknowledge this stress for our children. So stress actually comes in a lot of different formats, and there is positive stress that occurs for children and adults. And most likely, as in children, this is a wonderful opportunity for them to actually learn to build confidence, learn to capture the ability to develop coping skills, and resilience. So with a good stress, this is typically a stress where mom and dad, a loving adult, doesn't have to jump in and help. This could be a stress that allows them to know that this may be a little bit of a tough situation I'm going through, but I am able to get through it all on my own. And therefore, that is going to help build some of that confidence. Now we have something called tolerable stress. Tolerable stress is a stress that can occur and has occurred possibly before. We know we can get through it, but it's a much more serious situation. And in these situations, a lot of times the child benefits mostly from having a buffer. And that buffer is in the form of a caring adult, someone who has a positive relationship with that child who can then assist them in getting through this stress. Now, this stress may last a much longer time than, say, a positive stress might, but at the same time, it's still manageable from that child. And in this case, many times tolerable stress does not lead to any further complications of physical or mental harm. The harm comes into place with something we call toxic stress. Now, toxic stress is the type of stress that a child will experience for a prolonged period of time. This stress is going to be very threatening to that child as well. Their response to this stress often causes them to shut down. And in this case, there is no support. And that's how the toxicity of this stress occurs. There is no support system in place. And a lot of times this stress, because it has gone on for so long, actually can cause mental health issues. It can cause physical ailments as well too. So every person experiences stress. Our children are definitely most affected with it because they're in a developmental stage. And when they experience stress, especially the ones that are less positive, their body and their brains can actually be affected by these types of stress. For example, brain development can change. Their responses to stress may become more behavioral. And you may also notice a child who has more ailments. They may complain of headaches or stomach aches. And that's part of the process of having to deal with that long-term stress. It actually builds up in their bodies. Now, stress can definitely be managed through some coping techniques, and each level of stress is going to have its own. One of the key factors, though, is going to be that supportive adult. So if you're in a situation where your own children are expressing stress, being that caring adult for them is going to have such an impact on their lives. So whatever way that you can reach out to them when you're starting to notice this, acknowledge it. When parents acknowledge the fact that kids can go through stress and that child hears this and understands it, they're feeling validated. And to validate a child is very important as well too. Children suffer from anxiety and depression and all the same ailments that we do, but sometimes as adults, these symptoms present themselves very differently. So I know we're not going to figure these all out on our own, and we may need help from professionals. So never feel afraid to reach out to your healthcare provider for the treatment process or just guidance on exactly what's going on. We've had a lot of change in the last year, and so our kids have definitely experienced a different level of stress than we've probably ever seen them deal with before. But you know what? This too will be something that helps them build resiliency and coping mechanisms And having that supportive adult in place is definitely going to benefit them. So just don't forget, every child can experience stress. Every kid may have a bad day, just like we do. So whatever ways we can do to help them and support them in this process is going to be beneficial. So from my family to yours, thank you so much.